Good afternoon. Good afternoon, colleagues. Good afternoon, dear participants. I am very happy to greet you, to welcome you to our 9th webinar under the Health System for Early Childhood Development Joint Initiative, which is led by UNICEF and WHO. And the theme of today's webinar is strengthening routine health care for building the resilience in young children and families affected by war and displacement. As I mentioned, it's not a first meeting, so I'm sure you are familiar with the way the webinars take place, but please allow me to just spend a little few minutes on the housekeeping moments. For translation, please go to the, yes, as my colleague is helping and showing to you, please head to the little globe at the bottom of the Zoom page on the right bottom side. And then you can choose one of the languages. We have Bosnian, Croatian, Montenegrin, Serbian, Polish, and Ukrainian translations today. If you have any questions about translation, please, you can ask them right now. We have allocated a few time slots for your questions to the speakers and your questions related to the subject of the webinar. Please wait until this moment to ask your questions. You could also write your questions if you are scared to forget them in the Q&A or on the chat box in the Zoom. Please feel free to do it. I would like to present the program of today's webinar. We will receive a welcome note from Evelina Borisova, Regional Early Childhood Development Advisor from UNICEF Europe and Central Asia Regional Office, from Dr. Martin Weber, Team Lead and Quality of Care Team for WHO European Office, and from Mihaela Ionescu, Program Director of ISA. We will see a keynote from Dr. James Cairns, Senior Director of Strategic Engagement and Organizational Learning Center on Developing Childhood at Harvard University. Later, we will hear some voices from the field from our colleague Anna Zleska and Katarzyna Akulic-Kazarin, who both work at the Institute of Mother and Child in Poland. Anna is the acting head of Department of Children and Adolescent Health, and Katarina is a researcher. We will also share a video from Ukraine, and Zarica Trikic will share. Could we please come back to the slide of the program? I think
there is a small mistake. I'm going to talk about the program on providing psychosocial care, and then we will hear from Dr. Martin,
yes,
health professional from Czech Republic. So apologies for this mistake.
Thank you very much, Zarica. And I think that will be the last presentation, isn't it, of the day?
Yes, we finish with frontline people. Okay, sorry.
Thank you. Thank you. Evelina, I would like to give a word to you.
Thank you so much, Oksana. I hope colleagues can hear me. Dear colleagues, partners, guests, first of all, it's wonderful to see so many of you with us today. And it's really a pleasure to be with you and on behalf of UNICEF's Regional Office for Europe and Central Asia to welcome you to the second webinar dedicated to supporting young children affected by war and displacement, with a particular focus on the humanitarian situation brought about by the ongoing crisis in Ukraine. I hope many of you were with us for the first webinar, and we really look forward to conversation today. Today, we will explore the significant connection between the well-being of young children and the environments in which they're raised. This is a topic very dear to many of our hearts who are working in the space of early childhood development. And as you will hear from our keynote speaker, Dr. James Cairns, scientific evidence already very strongly underscores that the development and resilience of young children truly depend on the quality of their caregiving environment. And central to this environment is the quality and responsiveness of the relationship between the child and his or her primary caregivers. To foster this kind of nurturing environment, parents and caregivers need to be attentive and responsive to the child's cues and needs. And these can be both expressed and unexpressed cues. And parents also needs to have the knowledge, skills, and capacity to engage with children responsively and to support their development. In war and displacement situations, as we know, the skills and capacity of many of those caregivers are significantly reduced, and they faced elevated levels of stress caused by lack of physical or economic security, traumatic experiences they're undergoing, or loss of social support networks. It's not only that they face those risks, but young children also experience a lot of distress, and together with their caregivers, I think they're at a much elevated risk of mental health and well-being challenges. In this context, both young children and caregivers require timely and appropriate support to mitigate the impact of potential adversity on their mental health, as well as to strengthen their resilience. And in this context, healthcare professionals who regularly interact with young children and families have truly a unique opportunity to support the mental health and well-being of families. In their interactions with caregivers and children, they can initiate conversations about mental health, they can listen to parents and draw out their concerns, and they can also help parents identify signs of distress in their young children, offer psychological support, and truly collaboratively work with parents to identify the support that is required for themselves as well as for their children, including referrals to community programs, peer support groups, and more specialized support if that's needed. Today's webinar really aims to highlight the importance of integrating a mental health and psychosocial approach into routine healthcare services to address these needs, especially the needs of children and family affected by war, displacement, and other adversities. The mental health and well-being of parents have a direct and immediate impact on their ability to support their children, and as such, support to parental mental health, I hope we agree, should be a core part of all interventions aimed at nurturing our children, especially in an emergency situation. We hope that the webinar will serve, as usual, as a catalyst for new insights and inspire us to expand the support around mental health and well-being in the context of emergencies and beyond. And thank you for joining us in this conversation, and really look forward to a fruitful discussion today as we have in the past. And I think I pass the floor now to Dr. Martin Weber from WHO for his remarks.
Thank you very much, Evelina. It's always great to talk after you, because I don't have to say very much anymore, because you have effectively said it all. So I just want to say it's a great pleasure to co-host this webinar, the series of webinars overall between UNICEF, ISA, and WHO, and particularly this one today. You heard already, and most of you probably have been in the webinar just 4 weeks ago, which was the first part of our series when we were exploring the effect of the war in Ukraine, both on domestic populations and the refugee populations, the migrant population, Western European countries. So we take this over to the next stage. And as I said, and as you have just heard, Evelina effectively said it all. I don't need to say much more. We definitely want to strengthen the capacity of health workers, but also of other workers, of social workers, and of the families themselves to deal with the adverse effects on particularly young children, as you know, who have problems of expressing themselves in contrast to older children. So it's much more subtle, and you have to build up skills in a much better way to deal with the adverse effects and to promote early childhood development. That's all from my side. I don't want to hold you up much more, and I hand back to the moderator again.
Thank you very much. And yeah, just as fast, I'd also like to pass word to Michaela.
Well, Evelina, Martin, I will have a few words to say, although you have covered a lot. I would assume that colleagues have understood how committed we are to the topic. But certainly on behalf of International Step-by-Step Association, I want to welcome everybody with a warm greet. And yes, it's true, there has been a REACH series in general in 2023 under this initiative. But I'm particularly honored to say a few words at the beginning of this webinar that focuses on building resilience in young children and families affected by war and displacement, particularly through routine healthcare. But there are a few reasons for which this is a very important topic for ESA. Being a network of early childhood organizations that are strongly connected with the work on the ground, and since the first days of war, we sadly realized that professionals working in early childhood services across different countries, including Ukraine, were in great need of support to be able to confidently work with children and their caregivers who experience traumatic situations. We as a network have been always committed to and work towards providing quality early childhood services that ensure the healthy development of young children and their well-being, as well as the well-being of their caregivers. So learning about the acute need to ensure an attuned support to young children and their caregivers as a network with rich early childhood expertise, we have been well positioned to promptly respond with timely capacity building programs from psychological first aid and trauma-informed approaches that reached out in a quite short time in our partnership, very effective partnership with our members, but also with UNICEF regional office, to a large number of professionals from different sectors. The professional need was dire, as well as the imperative to safeguard the child's healthy development and the resilience of the adults around them. Even more, when we're providing the trainings, we realize that such type of content has never been included in the preparation of early childhood professionals. While noticing their high interest and involvement in the training, as well as their very positive feedback regarding the content and the format of the training, it mattered not less the focus on their well-being and how they can protect themselves from burnout, which is not difficult to occur in such quite emotionally intense interactions and situations as they have been exposed to. It became very clear to us that all early childhood professionals, from primary health to education and social protection, those who are working directly with young children and their caregivers, who have suffered from work context and forced displacement, must benefit from pre- and in-service training programs that bring them awareness about their role, the competence and confidence in the way they approach children and caregivers who have been through traumatic situations. They can make a tremendous difference. And feeling competent and confident in such demanding times as an early childhood professional is key for building resilience among children and their caregivers, as well as among professionals. So we are very glad to discuss today about the important contribution that primary health workers can bring alongside all other early childhood professionals in building this resilience, and looking forward to hear from our guests and also from you, the audience, of how we can be more strategic in strengthening the capacity of those that do the hardest, but also the most impactful job. So many thanks to all of you being part of this important discussion. Oksana, over to you.
Thank you very much, Michaela. Thank you, Martin. Thank you, Evelina, for opening up the webinar and for setting an excellent context and framework, I think, for the further discussion and learning to happen. I just wanted to note that we have participants from all over the region, from Scotland all the way to Azerbaijan, but also a few participants way outside of the region from Ethiopia and Nigeria, which I think is very exciting. And another thing I just wanted to apologize for, I forgot to introduce myself. I'm very excited about this webinar because I am a mental health professional. I at the moment, I work alongside Evelina in UNICEF, Europe and Central Asia region, and I am a specialist in adolescent mental health and psychosocial support. So I guess just that made me too excited, and I wanted to run and host this webinar as fast as possible. Right now, I would really like to introduce Dr. James Cairns, who is going to introduce evidence base for the toxic stress and childhood adversity and how it affects children and families in their development, and also introduce a key scientifically based principles for building resilience and supporting resilience and building supportive services. I'm really looking forward, to hear you, Dr. James, because I think it's very important to make this link between theory, between the knowledge of how adversity impacts children, but also how to really adjust services and what can we do about it on a practical level. The floor is all yours.
Great. Thank you, Oksana. Greetings, everyone. Thank you to WHO's regional office, UNICEF's regional office, and ESO for the invitation to be with you today. So greetings from the Center on the Developing Child at Harvard University. If you don't know our center, our core mission is really to take the rich and ever-growing body of knowledge from multiple disciplines about how human development happens, particularly in the earliest years of life, and to sort of translate that and make that accessible and usable for those of you who are concerned with and committed to improving conditions for children and family all over the world. I will say that I am not a researcher in the sense of my background is not in the research and science of child development. I am a good example of how the way our center's content can help all of us both understand and use this knowledge base to advance the work that we're trying to do. So, what I want to do in the time that I have is cover sort of three major points. And what we're looking at is how does this knowledge base give us collectively insights and tools to think about the work that we do, how we can improve it, and to be attentive to what's going on in the young children and families we're working with. So we're looking at resilience as sort of the goal here. And I want to talk a little bit about why are these early years so distinctively important, to talk a fair amount about the reality of stress and adversity and what that's doing in the body, and then really look at the concept of resilience and how that gives us some tools and principles to think about the work that we do together, particularly looking at the healthcare setting, which is the focus of today's webinar. So, children birth to 5, it's not just that they're little and young. There is a distinctive phase of development that's happening in these years that is unique and is setting foundations for the rest of our lives, not in a determinative way, but in a foundational way of setting us up for either positive adaptation or some negative consequences. And what we know is at birth, we have all of the neurons and cells in our brains, but there's very little connectivity. That connectivity, what we call brain architecture, the wiring and connection in the brain, is being built in the context of relationships and early experience. So we have to think of this as building over time, starting with really basic circuitry, and then moving on to more complex, sort of higher executive functioning and so forth. And so this happens in the interactive relationships between infants and their caregivers and others that are interacting with them in their environment. And so that environment and those experiences, whether they are good or bad, are sparking the signaling and connections within the brain and building these different circuitries and therefore capacities and skills. So we can think of this as like building a house, sort of that early foundation, and the stronger that foundation is, the more stable and productive everything that's being built on top of it will be. So why is this early period so important? And here we want to talk about a concept known as brain plasticity. And so in these early years, as all of this wiring and architecture of the brain is being developed, the brain is most open to adaptation. As you will see here, over time, that plasticity or adaptability declines, and it does that for a very important reason. because what we are using and doing over and over again, the brain is reinforcing and becoming more efficient at that, and then pruning away those circuitries that are less important or not being used. And so over time, it takes more energy and more cost, if you will, to make adaptations, to address sort of the kind of capacities and skills. And as I'm sure happens for all of us, you immediately went and looked at that sort of horizontal axis and found your age. Don't worry, that line never goes to zero. And so if you wake up tomorrow morning and remember something new that you heard today, you built new synapses in your brain. So it's not a lost cause. But what's important here is we have an opportunity in these early years to set these foundations and to develop the kinds of capacities and skills that can serve us well throughout life. And so the headline here is timing matters. And so when we think about exposures to adversity or positive experiences, how children respond to that and when they're exposed to that really matters. And so across a range of different factors, whether that's exposure to sort of chemicals and toxins, we know about lead, exposure to violence, that depending on when that happens, and if that's a 2-year-old that's having that experience versus a 10-year-old or an 18-year-old or a 25-year-old, how those experiences are affecting the development of the brain and other bodily systems is important for us to pay attention to. And so in these earliest years, these developing systems are the most sensitive to their environments. And so let's talk about stress. This phrase toxic stress has been out there for a long time. And what we're talking about here is that it's important for all of us to learn how to cope and to deal with adversity and challenges in our environments, in our lives. And if that stress is significant, extended, it can have damaging effects in different circuitry and parts of our brain and in other biological systems in our body. And what's important here is to understand that we're actually talking about 3 types of stress response. So toxic stress is the phrase that has gotten sort of popular and used, but it's important to understand it sits in the context of 2 other dimensions of how we're responding to stress in our bodies. The first is to understand that there is positive stress, that for young children in particular, learning how to sort of cope with their environments, to deal with fear, to deal with challenging situations like going to the doctor or going to preschool or in the normal life. And so we all know what that stress response feels like, right? Our heart rate goes up. We might get a little sweaty on the palms. There's some anxiety there. But in the context of supportive caregiving relationships, this is buffered and sort of brought back down to sort of normal levels. And it's the way that the body and the brain are learning to build these coping systems and regulate that kind of response. There are much more serious kinds of stressors in any of our lives, and particularly for children. And so I think in the context of this webinar and thinking about crisis situations, we're coming into, at minimum, a tolerable stress environment where there are significant adversities and stressors happening in the life of the child. And that could be displacement from conflict, a natural disaster, major health issues in the family, those kinds of things. And so that's a more extended experience of adversity in that child's life. And again, the key here is if that's happening in the context of consistent supportive adult relationships, that's helping that child sort of buffer and figure out how to cope with that situation. It's only in the prolonged, and when we say prolonged, we're talking weeks and months here, activation of that stress response system being elevated in the absence of the protective relationships that are provided by caregivers. And so I think the key here is that we are all quite adaptable. Our biology is has been developed over eons for adaptation to success and coping and surviving. And so that the toxic stress is not something that happens in a couple of days. It's a persistent situation over weeks and months. And again, the key here is in the absence of having those caregivers who are supporting that child. Now, so we've talked about, this stress response, the fight, flight, freeze, those created by stressors in the environment. And for a long time, this from our center and others, have talked about the effect that this has in the brain, in brain circuitry, in how that shapes learning and other kinds of capacities. We also know, and I think this is particularly important as we talk about the health sector, there's a rapidly growing body of knowledge that the reality of this stress response process isn't just affecting the brain. That actually our bodies, surprise, surprise, are highly integrated. And it's a set of biological systems within the body that are highly coordinated. Each of them have their particular role. We can think of this as like a highly skilled team, soccer, volleyball, pick your sport, where each player has a particular role, but together they are working in a highly coordinated way. And so the brain is providing that kind of overall coordination and management. But if you think about the heart and cardiovascular system, our metabolic system, the immune system, and the neuroendocrine system, each of these have a particular role that gets activated in acute stressing moments. And when that stress and that threat goes away, those systems calm back down. Except in this situation where we've got this constant ongoing kind of adversity. And so what's happening here is if these systems are elevated all the time, it's creating a corrosive effect. And so if you think about longer term health challenges related to things like cardiovascular disease, hypertension, diabetes, even depression, and some other cancers, a lot of them have risk factors related to things like inflammation. And so again, that immune system, sort of that inflammatory response, is very effective and important in acute moments. If that stays elevated for a long period of time over time, that inflammation is a precursor for a lot of troubling and problematic things, both in physical and mental health across the life course. The same thing with the metabolic system. That glucose, getting that energy kicked up. But again, if that's chronic, we start to see factors like diabetes and other kinds of chronic disease. So the take home here is that our work to support families and young children is just as important for building foundations for lifelong mental and physical health as it is for strong foundations for learning, social emotional development, and school readiness and other kinds of life success. So in the context of crisis, I think we need to understand that this stress response is happening both in the child and in the adult. And so in this graphic, the red part of the brain with the exclamation point is the autonomic, the sort of automatic response part of our systems that gets triggered by threat and stress and other kinds of stimuli. The blue gears are the more sort of the cognitive, the executive function, those things that are part of our prefrontal cortex, the planful, thoughtful types of responses. So when there's this kind of constant stress and adversity in young children, as their brain is developing in the environment that they're living in, those automatic response parts of the brain are the ones that are getting more developed, if you will, because in the environment that child is in, it's reading, it needs to pay attention and have very good skills and capacities to respond to threat in that environment. And so that means there are other things that are less developed. They're not getting as much energy and attention in terms of those other executive function, regulatory, cognitive, and social emotional kinds of supports. These stressors are also affecting the adults. And so even if, in a situation where in our own development, historically, we have built good capacities in both of the kind of automatic and more sort of executive kinds of skills. When any of us are under stress, those automatic responses kick in. And I think any of us can sort of relate to, if we've been in an emergency situation or a highly stressful environment, we're not thinking about long-term plans, right? We're worried about what's happening in the moment. And so the double whammy here, and the really important thing to think about, is that stress is affecting the adult, which means that that adult doesn't have the kinds of capacities he or she would ordinarily have to provide that buffering responsive care to the child. And so the child is both experiencing that stress and it's not receiving the kind of support and care it would ordinarily receive from its caregivers in that kind of environment. And I think it's important to understand this as we think about mental health and the themes that we're talking about today in this context. And so what we know from a lot of research is that if there are mental health challenges in the caregiver, and we know particularly with the mother, there's a lot of research on maternal depression and other kinds of mental health issues. What's happening here, and the reason that's so critical and important, is it's getting in the way of that caregiver being able to be responsive. We talk about the serve and return interaction with children. And so it's disrupting those patterns and the ability of that parent and caregiver to be responsive. And therefore, in that context, the children are producing higher and more fluctuating levels of those stress chemicals that are then circulating and keeping that whole system of response elevated. And so, and we also know that again, this is not determinative, but that children who experience a lot of adversity early on have much higher risks for emergence of mental health challenges and physical challenges later in their life. And so I think often when we're responding to these challenges, and particularly in the health sector, often the adult and the child are treated as separate patients. And I think in particular here with young children, we really have to understand and look at this as the dyad, or as within the relationship. And so how are we addressing mental health challenges in adults in a way that's really understanding and seeing that that's in context of how they are relating or not able to relate to their children. And so, and you know, young children, just the level of where their brains are, they're going to respond in different ways. This goes back to this timing concept, to these kinds of environments and situations than would older children or adults. And so we need to think of this as what's happening as setting foundations. And so it's both in the immediate term, but also what are we setting up in terms of that pathway over time. So that's the part of really trying to understand what's happening within the body and within these relationships from stress and adversity. Let's turn to a more sort of positive, if you will, side of this and really talk about resilience and what we're trying to sort of support and help develop. As a definition, at its heart, resilience is a positive and adaptive response in the face of significant hardship or adversity. Now, there's some things that we know from the research around resilience that are important to stress because they often run counter to the way that the idea of resilience is talked about in sort of popular and general terms. These capacities are built over time. Resilience is not a trait. None of us are either resilient or not. We aren't born with it. It's something that's built through experience and over time. And it is in the interaction of positive factors in our social environment and our own responsive biological systems. And it is built through a combination of, these things are all going to come up many times, the context of supported relationships, adaptive skill building, and the positive experiences in our lives that are forming this foundation. It's also really important to understand that resilience can be situation specific. It is not a generalizable outcome. And so I might be able to be resilient in a certain part of my life, but not others. I think one important example from people who experience a lot of structural inequity, there's a lot of research where they might be thriving and have figured out a way to be very successful in a career, and successful in sort of raising a family and economically, and there are often very significant underlying health issues. And so some parts of us can be resilient and other parts may not be. We might be resilient in the face of a particular kind of adversity, but not another. And so again, this is not sort of a fixed thing. It's helpful to think about this as a scale. And so what are we putting on the positive side and what's happening on the negative side? So, things like conflict, displacement, poverty are negative experiences, are putting stress on the body, on relationships, and so forth. But there are a lot of things that sort of can weigh on the positive side of this. So responsive relationships, the kind of building a sense of agency, kind of the collaborative and coping skills. What kinds of services and social capital are we providing to families? And this is one that sometimes doesn't come into the conversation as much when we talk about biology and science, but there's strong evidence that shows that drawing on faith and cultural traditions is a really important sort of positive factor in helping build resilience. That sense of shared belief, shared practice, the speaking about sort of the history and legacy of a community, all of these things are really important in helping create coping situations. Now, there's one more part of this scale that's important, and that's that little fulcrum at the bottom. And here's where genetics comes in. So that fulcrum, there's a part of that that is determined by our genetics. We might think of this as temperament. Each of us is different, and our sensitivity to our environment is genetically based. And so where that fulcrum sits, as you can see here, if we go again, can make it easier or harder to get the kind of positive outcomes we want to see. So when that fulcrum moves as it just did, it makes it much easier for negative experiences to sort of tip that scale in the negative direction. Now, the good news is the fulcrum is not fixed. The genetics might set its starting point, but it is movable by the kinds of skill building and capacity building. And so if we're providing those responsive relationships to people, if there are opportunities to build that sense of self-efficacy and agency, that's actually moving that fulcrum so that as each of us experience challenges and adversity later in our life, we've built some tools and skills in coping and responding that can help us sort of tip that scale in a positive direction. The last thing I want to say about resilience is that as we've talked about this as a concept over the years, we've started to realize that we have to be careful, that it can end up making it sound like the responsibility to ensure resilient outcomes for children is left to the family and the caregivers themselves. And it's not, we're activating an assumption there that is not helpful, that it's all about family dynamics. And we're putting a lot of burden on families who themselves are being affected by things in their environment that are out of their control. And so we need to understand the kind of, quote, actors. What are the things that are helping shape resilience? What's pushing on different parts of this scale? And I want to touch quickly on 4 things. So we've talked about the role that family and community supports can play on the positive side. In the absence of those are then creating sort of potentially some negative pressures on this scale. What kinds of programs and services are available? Are those programs and services easy to access? Are they responsive to the needs and the contexts of the families that they're working in? What's happening in the broader physical and built environment? Are there exposures that are negative? Are there parts of that environment that are positive? How are we dealing with the environments of families who are displaced? Is there safe housing, and is there clean water and access to food and other kinds of services? And finally, there are systemic factors in all of our societies that are, again, actors on whether those are pressing on either the negative or positive sides of this scale. So I think as we think about the context in which we work, and particularly in these sort of crisis contexts, what's going on in the broader environment around families that is contributing either in positive or negative ways to the ability to create these kinds of foundations for resilience. Boiling all this down, hopefully, to something that's a bit practical here, I want to think about 3 principles. None of these will sound new if you've been listening, but we can use these to think about the programs and services that we're providing, and paying attention to these things in any way and in any place we're interacting with and providing services and support to children and families. How are we trying to reduce sources of stress? Sometimes that's difficult given the environments we're working in, but in any way that we can, paying attention to reducing those stressors on families and children, supporting these responsive relationships. And I think I've talked a lot about that responsive relationship between adult and child. There's also the idea of responsive relationships between service providers and adult caregivers. So in a doctor's visit, in a health clinic visit, does the parent feel heard? Do they understand that their own situation is being addressed and supported, even as the focus is on the child? So how are we ensuring that those service relationships, adult to adult, are also characterized by this kind of responsive, supportive dynamic? And then finally, how are we helping build adaptive skills? Are we providing opportunities for adults and children to practice building these kinds of coping skills, other kinds of capacities that give them a sense of agency and ability to deal with the environments that they're in? And I'll close by connecting these principles with the nurturing care framework, which I think has been a really important framework for all of us in the early childhood field over the last number of years because of its clarity. It's also very strongly grounded in this science as we think about sort of early learning and skill building, that kind of safety and security as a way of buffering against stress, responsive caregiving, and of course, health and nutrition as critical foundational components of this. So thinking about how are, in whatever way, the set of actors and services that are being provided, and how in the health sector in particular, are we paying attention to all of these components to ensure that the services we provide and the care that we provide is contributing to the factors that build resilience in adults and kids. If you don't know about our center and our website, there's a huge amount of material on all of these topics I've just talked about, which you are welcome to go dive into. So I will close there. Thank you very much. And I will look forward to the ongoing questions and discussion from the webinar.
Thank you very much. Thank you very much, Dr. Cairns. Excellent presentation. And I just really, I'll take advantage of being a facilitator and maybe repeat a few things that really, I think are very, very important, especially for someone who is working in healthcare and dealing with children and parents affected by adversity or traumatic event or displacement, whatever you name it, on an everyday basis. Yeah. This accent on placing both stressors, but also resilience, not inside the patient, but in between, in the relationship, but also in the relationship within the family, but also in the environment and in relationship with the caregivers, service providers in a wider sense. I think that's on one hand very liberating for the patients, but also for the providers, at least for myself who worked in healthcare for a number of years. It was always much easier to do something what's in your hands if you understand that it can have impact, rather than thinking, how do I help this person, where everything is inside his head, and how do I deal with this trauma. It's not always trauma. Sometimes it's just that struggles that you face in everyday life as a displaced person. Thank you so much. And now I would like to give floor to participants. We have 10 minutes, unfortunately, for the questions. So please go ahead and ask them, raise your hand. Yeah, I think we don't have anyone who would like. Yeah, Zorica.
No. I just wanted to say that I would like to share greetings from our colleague Vera Rangelova from UNICEF ECHO. She was observing and following the questions. So we have, let's say, 2 questions that we can start with. The first question is, could you, James, tell us something more specific? What kind of interventions could be integrated in routine health services that could support well-being and mental health service of young children and their families? And the other question is, in a way related, is how health and ECD specialists can support the family if everybody is affected with the toxic stress. If they're all under toxic stress, how then, for example, health system comes in, and what are the interventions that could help?
Thank you.
I'm sorry, Vera has some issues with the microphone and things like that, so that's the reason. But thank you, Vera, for supporting us.
Thanks, Zorica and Vera. So I am not an interventionist, so I don't want to stray too far into territory where I'm not an expert. What I do want to say is that I think there are 3 important elements in this story that should shape the kind of intervention we think about. So the first is this idea that thinking about the kind of health, mental and physical health of the adult and the child completely separately from each other doesn't help us in this situation, particularly for very young children. So as we think about interventions, what are we doing that's making sure that we're paying attention to the interactive reality of the environment in which that family is living? I think the second is that some kind of family therapeutic approach, if there's referral to or into a more sort of I don't know, advanced or more specialized kind of treatment, again, I think and there's a rich evidence base of different kinds of therapies that have shown some effect. But it's looking at, if we're only treating the parents' mental health issues or depression and not doing that in the context of how that's affecting the relationship with the child. I mean, that's the story here. It's that most importantly, for very young children, all of their experience is happening in that context of relationship. And so if we're not paying attention to that in how we're addressing challenges in either the adult or the child, we're missing an opportunity. I think that the third thing is the awareness of the kinds of factors that do support resilience. And so how are those who are in those clinical relationships looking at that broader environment. What kinds of, are there programs or other kinds of services that are focused on the skill building aspects of life and providing that kind of coaching and support in a variety of ways that can address those things, as opposed to just, treating or providing information. Moving into that second question about supporting families when the entire environment is completely stressed out and traumatized, as is often the case in major conflict and other kinds of crisis settings. I think the key here is that responsive relationships for young children do not have to be provided by their parents or immediate caregivers. If those caregivers themselves are highly stressed out, are traumatized, are dealing with their own significant challenges, who else is available to be providing a stable, responsive, supportive environment for those young children? It could, and this is another place then where clinicians, other service providers, other actors or people in that community need to step up and need to be aware that if the way we're providing services to families is relying on the caregiver to be that support and that creating that responsive relationship largely on their own, if they're not able to do that, we need others in that system to step in and do that. It could be a teacher, it could be other kinds of counselors. What kinds of programs or settings are we putting together? But so for those who are coming in, if you will, into those environments of crisis, who are not themselves part of the group and the community that's been directly affected, it's kind of on us then to be the ones who are able to be aware of this, what's going on in these relationships, and providing those kinds of care and support. And I think the more that that those who are providing those services understand these dynamics of early development, it allows any of us then to use those principles to say, okay, is what we're providing helping reduce stress in whatever way it can? Sometimes that feels minimal, but little bits are important. Are we paying attention to and creating those responsive, supportive relationships around the family? And what are we doing to help sort of build those coping and resilience kind of mechanisms? So I think that's the way that we have to sort of tackle this.
Thank you, James, for mentioning that we have to work together, that it's not the job of one sector or one role. Oksana, we don't have, since James said clearly that he is not really interventionist, I think that were the questions, so we can move on. Thank you so much.
Thank you, James. Thank you, Zorica. If no more questions, I would like to introduce our colleagues from Poland, from the Institute of Mother and Child, who is a long-standing partner of UNICEF in the country. And I'm really excited because what Anna and Katarzyna are going to speak about is the study that they conducted and the intervention, the program that they developed on the base of the knowledge that they gained during study. They found out, they detected needs, and then they tailored to these needs. They developed a program for supporting Ukrainian parents and caregivers who moved to Poland. Let me introduce again your your titles, colleagues. Anna Zleska is acting head in Department of Children and Adolescent Health in the Institute of Mother and Child, and Katarzyna Kulic-Kozarin is a researcher. Thank you very much for joining us today, and floor to you.
Thank you.
Thank you.
We will try to share our screen, and please let us know if you can see it properly.
Yes, we can see it.
Okay, great. So I think that maybe our presentation will be a kind of answer to the last question about what to do and what can be done, because we tried to empower, to add strengths, mental health strength, and build resilience in parents to make them able to support their children. We talk, of course, about parents who fled from Ukraine to Poland when the war started, or even a few months after that. So as researchers, we work both in the Institute of Mother and Child, which is a hospital, but also a research institute in Poland, in Warsaw. We started our, it's not changing, sorry. I try to change the, yes, great. So I managed to change the slide. So we started with a study to identify the needs of parents who migrated to Poland, to understand the resources and needs, and how can we support them in supporting their children, the mental health of their children. So we organized the study in a form of focus group interviews, and asked participants about their life in Poland, the difficulties they met, fears they have, adaptive mechanism they apply, to ask about their health, especially mental health, and how do they cope with the current situation. And we organized the study in 2 locations, Lublin, smaller town, Warsaw, the capital city, and in groups divided by the age of children. So we had groups of parents of very young children and parents of adolescents. And what we learned, very briefly, we would like to present you the key findings. So first, we started understanding how mainly mothers who arrived to Poland with their children feel themselves, how they suffered with flashbacks, with the feeling of temporariness, that they felt detached really from the reality and felt that there is nothing certain in their world, actually. They were extremely sad and felt lonely. Also really exhausted with the current situation, with everything that they had to deal with. They were mourning for what they left in Ukraine, not only their relatives and their friends, but also their home, their previous normal life, and of course for their country. What was probably the most surprising for us was the feeling of guilt. They felt guilty because they were safe and because they were not fighting for their homeland. And also they felt that their relationships with people they loved were at risk of brokening. The only positive feeling they expressed, at least some of them expressed, was hope, but it was rather rare. We also asked about their physical health, and you can see here some quotations, but in general, as you can see, they talked about all physical symptoms of high stress, like problems with eating, sleeping, with skin, hair, or teeth, everything. How they cope, or what helped them to cope with the current situation, was first of all focus on the child. Well, the one maybe positive element of the current situation for many mothers was that finally they have more time for the baby, because they had nothing else to do. They lost the job. They could only spend time with a child. What also helped them to cope was a kind of routine in their everyday life. Of course, work, if they had one in Poland, but also a lot of them engaged in helping others, what was a very strong protective factor for their own mental health. They practice their hobbies or adapted new hobbies, what was really helpful also. What they appreciate really was being among other Ukrainians, being in a group of people they felt they understand them really well. And if they were able to think about the future, it made them less focused on the current really difficult situation. But of course, they used also less, let's say, positive or healthy ways of coping, like self-medication, using a lot of tranquilizers, as you can see here in this citation. So knowing all this, we decided that the program we are going to develop has to focus on two objectives. First, we have to improve the well-being of parents and caregivers to make them able to support their mental health of their children. Otherwise, they won't move forward. So the next objective of our program was to develop the ability to support children in the face of adversity and difficulties. So giving or showing parents new parenting skills, or they maybe didn't practice earlier. We base our program on the resilience theory, of course, and the practical lessons from cognitive behavioral psychology, including practices of mindfulness. And here you can see the content of the program. So we talked about this basic resilience skills. We practice with the parents active listening, expressing and accepting feelings, communication skills, strengthening self-esteem of themselves and of their children, self-awareness and the ability to think positively, setting goals and how to approach these goals step by step, dealing with conflict situations, the ability of giving positive feedback and to drawing consequences if a child misbehaves, and at the end we try to summarize all the skills we practice during the whole program. One of the biggest strengths of our program were the trainers, because it turned out that not only parents fled to Poland from Ukraine, but also a lot of mental health specialists, psychologists, educators, other practitioners from Ukraine, and so within less than 5 days, we were able to recruit, as you can see, 41 Ukrainian-speaking trainers, people who learned how to implement our program, who attended 5 days workshops to prepare themselves to work with groups of parents. And during these workshops for trainers, we prepared them to work with groups of up to 15 parents, caregivers, to implement this program consisting of 10 workshops, in total 20 working hours. And besides the scenarios in the manual they received, there were a lot of guidelines, practical exercises, and so on. And a lot of information for them as well. And as researchers, we also try to assess what are the outcomes of our program. So we planned a study to assess the outcomes of this program using a pre-post design. We collected the data from parents, caregivers who attended the program. In total, we had 630 participants, but pre-post data we managed to collect from 532. The anonymous questionnaires were administered by the trainers themselves before they started the implementation of the program and after the last session. And we used the well-known scales to assess the participants' health, resilience, coping skills, for post-traumatic growth, and what was also very important for our program, parental attitudes, to check whether parents learned new skills, how to work with their children. And here you can see some results. Here we are on this slide we are showing changes in participants' health, and as you can see, all of them in all dimensions we observed very positive changes, especially in well-being and mental health, which improved in great majority of participants, but also there were a few cases where it was deteriorated, but gains were much bigger than losses, actually. As you can see, we observed also significant changes in terms of resilience, which grew up in the whole group of participants after the program. We also observed positive changes in all dimensions of post-traumatic growth, especially in better relating to others, and in observing new possibilities which can be which are available for them in this new situation. We also observed positive changes in terms of parenting skills. As you can see here, we used a scale measuring parental attitudes, and two of them are for sure those we wanted to empower. The first is acceptance of a child, and the second is giving a child more autonomy. And we observed also decrease in less, let's say, positive parenting practices like excessive demands to the child, or excessive protection, or inconsistency in child development in parenting. So we are really satisfied with these results, and we hope that the program will it's still implemented by our trainers, so I hope it serves other parents, and I think it's a kind of good example how mental health of refugees can be supported by other refugees, actually. Thank you. Thank you.
Thank you very much for this excellent presentation, and congratulations on developing a very successful program. 500 participants is a huge cohort, yeah, to be honest, for an intervention that's been recently developed. Congratulations.
Yeah, actually, the program was implemented. The results I show you are the results from the implementation of the program in the last 3 months of the past year, so between October and December 2022. So, yeah.
Thank you very much. Thank you.
Thank you.
I would like now to pass the word to a colleague with whom I had experience to work before, so it's a huge pleasure to introduce Zarica Trikic, who will I think you will co-lead your presentation with Dr. Martin, who is one of the participants of the training program that Zaritsa conducted and led on. And yeah, she's going to share with us.
We did together first training, yeah.
Yes, exactly.
Yes.
Dr. Martin Chalupka. So the word to the two of you. Of course, yeah, I forgot to mention that, of course, Zaritsa is presenting ISA, and Zaritsa is one of the leading specialists and co-author of the trainings and programs that ISA is implementing at the moment.
Thank you, Oksana. It's so good to work with you together again. And hello to everybody. As you've heard, my name is Zorica Trikic, and it is a great pleasure to talk about this topic today. I hope this is one of the ways to give voice to the children and their caregivers facing adversities, wars, and displacements at this very moment. And also to give voice to all the professionals who are giving their best to support those in need. Sorry, I usually speak more fluently, but this is very emotional for me because I think it's a good timing for us to speak about these topics. And today I'm just going to continue what my colleagues from Poland were talking about. There is a hope, there is a way, there is a mean to support those working on the front lines, early childhood professionals, in their work and in their efforts to provide high quality services to children and families suffering because of the wars and displacements. And this is the program that we developed together. That's why I said it's good to see Oksana again, because we worked together on initial format of the program. The program was developed by ISA, War Child, and ISA's member, AMNA. And our aim was to respond to the high demand among ECD professionals in Ukraine, but also in other countries, neighboring countries, receiving countries. There are many ways how we call them, and provide them with the support for providing psychosocial support to children and families, because everybody was totally overwhelmed. As Michaela, my program director, mentioned at the beginning, professionals were overwhelmed. Nobody prepared them for what was coming. And despite the fact that unfortunately in our network we have members in the countries which went through awful wars or are still in the wars, nobody was prepared for this kind of situation. And the war in Ukraine was just a trigger to mobilize the expertise that we have in the network and to do what ISA is usually doing the best. And this is to get together and develop and deliver foundational training of trainers on psychological first aid and trauma-informed practices with young children and their caregivers, and then to use people and members which are working on the ground to roll out the training using cascade model to reach as soon as possible to as many as possible early childhood professionals. And this is in the training package, because ISA also did a lot of work in Greece and Germany during the refugee crisis. So some resources like building bridges were built for Greece, but they can be used everywhere. But in the package, we have this guide, a training guide, and we also have activity cards, hands-on materials that professionals across the roles and across the sectors. And I want to mention and stress that as many times as possible can use whenever they need it. I'm just giving signs to Jen to change the slides because my technical abilities are very limited. So what is the purpose of the training? The purpose of the training was to close the knowledge and skill gap that exists in the early childhood workforce capacity, and to ensure that they have tools, skills, and sufficient knowledge to meet the needs of families and children. But, and this is a very huge but, the training is based on the following principles and values, which are defining that professionals should stay in the realm of their competencies. And these two principles are: do not do harm, do as much as you can without asking questions or digging too deep, without ability to deal with the issues that can pop up, which leads us to the second principle. We are not talking about psychotherapy. And these are two extremely important things. Do not do harm. This is not psychotherapy. So what are the building blocks? We have three building blocks. The first are the key concepts and guiding principles in providing first psychological aid and also providing trauma-informed practices. The other are working with distressed, how to work with distressed children and their caregivers. And the third one is how to manage stress in professionals, which is also applicable to working with caregivers. The training has 3 days. It can be online, it can be in person. It includes a variety of reflection, small group, big group works, and a lot of relaxation activities, and participants in the trainings are coming from different sectors together, and they work together. And you can also see the main topics that we try to address is how to react, how to understand the impact, really have deep understanding how the war and displacement is impacting children and adults. The topics of guiding principles in working with distressed children, and also how to adapt the way we react to their age and specific support they need, how to identify children who need first psychological aid based on the 3L model: look, listen, and link, which you will see was very challenging for professionals, especially from health sector, and also identifying children that we can support, but also children that we need to refer to the others, and how we can set up healing spaces, both physical and psychological, in every ECD early childhood setting across the sectors. How can we send, as James was mentioning, how can we send a message that people are welcome, that people are heard and seen, how to build networks of support between parents but also professionals, and how to prevent burnout of professionals. So what did we do so far? We managed to train since June 2020 until April 2023. We managed to train 190 master trainers from 30 organizations from 21 countries. I don't have time to read them, but it's like it's really impressive. Some of them are ISA members, and trainers were coming from different sectors, including health sector. Those trainers delivered training to more than 1,000 professionals and frontline workers in respective countries. And what is something that we didn't expect, but it popped up, that during the training, participants coming from different sectors started to build non-formal connections and non-formal networks of support, learning how they can support each other and how they can work together in the best interest of children and their families and caregivers, how and when to do the referrals. And what did we learn? Voices from the practice. This training can easily be adapted to different sectors. It provides good balance between theory and practice. And what was very important for people that we managed to provide them with clear understanding of concept, but also actions and processes in emergency and humanitarian context. It guides professionals to recognize the sign of distress in young children and caregivers, but not to jump to conclusions, not to put the labels, not to mix trauma or stress reaction with health issues or things like that, or that children are aggressive or they're not cooperative and things like that. It builds on existing strengths and capacities, but it also builds on capacity on the conditions in the practice, so it can be easily integrated and stresses and helps professionals better understand how this interconnectedness between families and caregivers and children, and how mental health of one influence the mental health of the other, and how important it is to include that in everyday practice, not only in crisis but on daily basis. The training also was seen as something that has a strong transformative power and put new lenses how professionals understand their role and responsibility. So it's not only about providing services, it's also about caring for the others, showing care, as our colleagues like to say, warm professionals. It also helps professionals recognize uh, signs of trauma and stress, and what they were saying, that these 3 L's, listen, look, and listen and link, was a mind changer, because they started to observe without judging, and they started to listen and ask questions and listen to the answers without jumping to solutions immediately. And they also felt comfortable to make referrals when it's needed. It also showed that it's very, very important to work on taking stigma from mental health issues and start talking about mental health as a part of general health. And what was also seen as a breakthrough for all who participated was this story about self-protection, how we can uh, take care of ourselves if we want to take care of the others. And what we also learned, that training is not enough. That's why we develop a whole system of coaching and learning exchange sessions. But thank you for listening to me. But instead of listening to me, let's go to the frontline worker. Let's go to somebody who is doing this work on the borders of Czech Republic and Ukraine, the one who is doing it on daily basis as a medical doctor from the Public Health Support Center in Prague. Let's talk with Martin Chalupka. Thank you, Martin, and welcome.
Hello, can you listen to me? Good. Yeah. I would like to say hello to all of you. My name is Martin Chaloupka. I work as a public health physician in the National Public Health Institute here in Prague, in Czech Republic. And for years, I have been working with foreigners in providing healthcare to foreigners, and I have found myself at the beginning of the previous year in the basically of the first line of contact with the many people who were escaping the conflict in Ukraine. And what I want to share with you today is our experience and our knowledge, what we gain, and also our experience with the psychological first aid. And I would like to have a little opportunity to make a little shout out to Zorica Trikic and her program from ESA, because to me and my colleagues from the National Public Health Institute, they were the ones who provided us with the psychological first aid training. And I would also like to speak to you about one of the things that this training proved crucial to what we were doing, not just in the first waves of contact, but also in the upcoming months and months of care providing to the people, to the refugees who came from Ukraine. Because one of the first, because our institute and our country, the Czech Republic, has got some previous experiences with managing and helping the people on the move and escaping from the conflicts. For example, during the 90s, when many people who were taking refuge from the conflict in the former Yugoslavia were taking refuge here in Czech Republic. And also many of us, myself too, were working to help the refugees during the European migrant crisis during the 2015 and 2016. But when we've encountered and found ourselves helping the people who were escaping the conflict in Ukraine, we felt that our experience and the problems that we faced were a little different during the beginning of the year of 2022, because the factors that we encountered, which were different, were two. The first one was that the overwhelming number of people who came, because we were used to the people were coming in waves, and we somehow manage take care of them. But was just through whole weeks. You have to I would say, in few weeks, our population of our country basically jumped up by 5%, and our public services and all of us need to accommodate them. And what was second thing, which was very different, was for us the composition of the people who were coming, because these were mainly families. These were parents, especially mothers with their children, because of course many of their other people were staying in Ukraine, fighting, helping with the conflict, helping their country. So we had to adapt to these conditions. What for us was really helpful when I'm looking back is that the psychological first aid concept is not just when you are thinking about the care and management of the people who are meeting with, because you are thinking about how are they responding, because when you are escaping conflict, when you are leaving your home country or home, you're not just leaving your life, your basic possessions, your material possessions, your loved ones, your connections, but you're basically leaving your whole life as in meaning of an ecosystem, because you function, you and your body function at a certain place, what you call home. You have there your friends, your family, you have your routines, your ways how to, for example, many people call, for example, where you have your health care, where you go to school, where you search for help, where you have your leisure time. And this is all suddenly ripped off through these people, and they are on the move, and they come to your country, and we are the ones who try to help them to find new connections, to build up, even if it is very basic, their new roots, just for the time being, to help them accommodate, to help them recuperate from which they suffered. And one of those things that we encountered and really helped us from psychological first aid was that you need to look not at just the people you help, but also at the people who help them. And as I mentioned in the beginning, this was not just like a two-piece equation. It was actually three sides, because we mainly talk about families here, families with children. And we just don't have the caretakers, the parents, the adults, their children, but also the professionals. And these three sides, we quickly discovered how sometimes often have different needs, but also their needs are reflecting on each other. As many of you, I think, will agree with me, it is sometimes when you are not prepared, and that is sometimes difficult to cross the boundaries between the various managements, departments, and sectors. So, for example, for us health professionals, it was, we have childcare, we have adult care. And one of these things that we really need to learn and need to understand was that, we need to understand the family care, because what happens to the parents, to the mothers, often is reflected on the children, on the child, how the children are behaving, how are they experiencing their new situations, and of course, how the children are coping. This also is reflected upon the parents. And we had to have also in mind for constant, the psychosomatic model. Yes, that the people who were coming to us with their problems, of their physical problems, were often interconnected with the stress and with the often real psychic trauma which they experienced during their escape, for example, from the war-torn areas of their country. So I think what my experience and what my message to you is that the integrating the psychological first aid into the healthcare is crucial, not just for helping and bettering the services that you give to these people, but also it can give you, when you, for example, as Zorica said, look, listen, and link. This, I called it myself, a little moment of pause to look, to listen, gives you much better understanding and crossing of cultural differences when you talk with the people, and you don't really even have to, you don't know how to understand their experience, because you weren't there, you didn't really experience it, you hear it from them. And also to not forget about the crucial third part of the psychological first aid, and not just that you think about the children, you think about the adults, you think about the people who you care, but thinking about yourself, about the professionals, because the overwhelming amount what we have to process in such a short time, and it really helped us to, I think, eventually cut it through and bring those people the help they need, because this was what it all was about. Because you have your people who need you, and you need to find for them the right care at the right time. So, and I think this is all my experience from the field. If you would like to have some questions for me, I will be happy to answer them. Thank you.
Thank you very much, Dr. Chalupka. Thank you very much, Zorica. Unfortunately, we are running out of time, and so we will leave only time for one question. Zorica, I saw that you already read and started answering, I think, on one of the questions in the Q&A panel, and it was about, yep, shall I read it out loud? I think Martin partially answered it already. So Svetlana asked if a similar training is also targeted on primary health care providers who interact frequently with caregivers and young children.
I can answer about our training, but I'm not sure is it also referring to a training provided in Poland, because in our training on purpose, we are doing our best to bring different sectors together, because we think that complicated and complex issues need people to work together. And this is also what James was mentioning today. We can call it a network of support. We can, in some happier or better organized systems, you have better coordination between the sectors, but health can be like in the center, because everybody's coming to health centers, but we should also take all this burden from their shoulders, and we should also empower them and encourage them to do referrals and work with colleagues from different sectors. So we do not try to do specifically targeted training. We started with training for early childhood education and care, and then we said, we can just have different case studies, and it's the same story. It's so similar. It's about, I'm talking about this part of the work. It's about caring. It's about being involved. And what Martin said, seeing the bigger picture, seeing connections between people you are working with, not see them as separate individuals. So yes, and yes, I think we have to work together and help each other to be able to help the others. Yeah, I hope this is the answer.
Thank you very much. Thank you, Zarisa. And you also answered, I saw in the chat, another question about partners of ESA and Step-by-Step
I don't know.
Foundation in different countries.
I don't know by heart. And it's not only my work. I have my colleagues, other colleagues working hard, doing hard work on this issue, and like Francesca, like Alyosha, and the others, and I think if you want to know more, we can connect, and yeah, we can provide information.
Thank you. Thank you. It's time to close this seminar, which at least for me ran very fast. I think it was very interesting, very dynamic, and yeah, I didn't notice how this 19 minutes passed by. I hope all of our 136 participants today felt the same way, and it was just as interesting for you as for me. And I hope you got some answers to your question about how to integrate mental health and psychosocial support in the routine health care. Yeah, and you learned about the training that could be provided and the basic principles of this training in building communication skills and building basic emotional support skills, becoming a warm healthcare provider, which really resonated with me. Everyone, I think, would like to go to a warm healthcare provider, whether you are surviving a crisis, whether you are surviving an adversity, or just having a health problem. I think we will all benefit from it, and it will help us to build resilience in future. We also learned about an excellent program that was developed in Poland and could be one of the solutions for people who need more support, and could be a referral destination for those who you can meet in your facilities, who come to healthcare but actually would need more of the mental health and psychosocial support rather than or alongside with medical care. And we also learned, and I just would like repeated, following what Martin said, that one of the big skills of being a warm healthcare provider is looking after yourself, taking care of your own well-being, because if you don't, eventually you won't be able to serve anyone, you won't be able to help your patients. So on this note, I would like to close our webinar today. Thank you very much. And I wish you, all of you, a very good and productive week ahead.